Today we're gonna do a narrow assessment, going through the cranial nerves and 1 through 12, and going through myotomes and dermatomes. For cranial nerve 1, it's for the olfactory. So basically, it's a smell test. So we're using icy hot as a smell test. So it's asking them, do you smell that? So that test for that. So next we're gonna test the optic nerve. So basically, it's reading how to read a scoreboard or some type of word. So cover one eye and read off the top line there.
Resistance tubes and bands.
Okay, and that's for cranial nerve 2, the optic nerve. Next, cranial nerve 3 is the ocular motor. We're going to use the pen light and use pearls. So what we're going to do is test the reflex on his pupils. So we're shine the light on one side, look for constriction. Okay, and we do the exact same thing, but now we're testing for consensual, meaning constrict on one eye and watching the other eye. And we're going to test for eye movement. So I'm going to have them follow my pen light, and we're going to do an H movement. All right, good. And for cranial nerve 4, trochlear, trochlear, it's going to be a down and in for the eye. We're testing that movement, so we're kind of making an X pattern here. Good. For cranial nerve 5, it's trigeminal, so you actually have subdivisions of 3 nerves. So it would be top, middle, and bottom. So another way you can also test that is have him chew, act like he's chewing. Okay, good. For cranial nerve 6 is abducens, so that's a lateral movement. So you can stop now. So we have the pen light here. Basically, we're testing his lateral eye movement. So we're kind of watching his eye there, and now we're going to watch for his eye as he goes to lateral movement. Okay. For cranial 7, it's facial, so any names, make a face, squint, chew, whatever. Okay. For cranial nerve 8, it's vestibular cochlear. It's hearing, testing his hearing. So it's kind of pointing on to the side, of which I'm snapping my fingers. Okay. Okay, good. Cranial nerve 9 is glossopharyngeal, so to say ah. Okay. We're testing for 9 and 10. Cranial nerve 10 is the vagus nerve. So you test these at the same time. So saying all just kind of test the vagus nerve also, so that passes also. So for cranial nerve 11 is accessory. So we just have to do a shrug, short shrug, and kind of test it there. And for cranial nerve 12 is hypoglossal, and basically it's move tongue side to side, up and down. Okay, good. And so that's for cranial nerves. Or for next, we're going to do myotomes. So myotomes is muscle brake testing for neck flexion. So I'm going to put my hand on top of his forehead, and he's going to flex forward. Okay. Same thing with the extension. Flex back. Okay. And that's for C1, C2. For C3, we can test for a lateral neck flexion. So to the side like that. Okay. Good. For C4, it's shoulder elevation. So just have them do a shrug. Yeah, I'm kind of test them like that way. C5 is I'm going to have his arms come straight out, and I'm going to push down. Okay. C6 is an elbow flexion and wrist extension. So I'm going to have him do an elbow flexion, and I'm going to resist. Okay. And C7 is going to be elbow extension. So I'm going to, yeah. Oh. I'm going to push up, and he's going to just pushing down. Okay, good. Okay, C8 is finger flexion, so just kind of clench your fingers. So I'm going to pull down like that. Good. For T1 is finger abduction. So he's going to have his fingers closed like that, and I'm going to kind of squeeze. Okay, good. And we also do adduction. So squeeze in. Okay. All right. So L2 is hip flexion. So we also we're doing a manual muscle test at iliopsoas. So for L2, I'm gonna have it flex his hip. So I'm gonna place my hand right here, have it raise his knee up, good. L3, knee extension. So we're gonna test his quad. So I'm gonna place my hand right here and have him extend his leg, good. L4 is dorsiflexion inversion of the ankle. So I'm just gonna test here, back and forth, good. L5 is this big toe extension, so I'm gonna have him flex his toe up, trying to break that, good. S1 is the plantar flexion eversion, so we're gonna go to the inside like that, good. And S2 is knee flexion with testing the hamstring, so I'm gonna push out, he's gonna resist that, okay, good. Next up is the dermatomes, so for C1, C2, I'm kind of testing the parietal side here. For C3, it's the side of the neck, so from the side of the neck up to the ear, that's C3. C4 is from here up to the upper trap here. C5 is the lateral shoulder at the tip, so the deltoid right there. C6 is the base of the dorsal thumb and thumb web, so in this spacing right here. C7 is the middle tip of the middle finger, so we're testing there. C8 is the lateral side of the fifth finger, so rubbing side along there. T1 is the medial aspect of the forearm, so we're rubbing that there. T2 is medial aspect of the upper arm, so up right there. And L1 is the anterior lateral hip, which is going to be in this area. L2 is the medial proximal thigh, so it's going to be in this area here. L4 is the medial lower leg, the medial foot, so basically from here all the way up here. L5 is the back of the foot and the bottom of the foot, so up here, bottom of the foot. S1 is the lateral side of the foot and heel, so outside and the back here. S2 is the posterior calf and thigh, so back of the calves and even back of the knee. And for S3 and S4, that's kind of more of a sensitive area, so we don't go there. And that's it for the neuro testing.